Um, so yeah, as Christine said, my name is Kenya Thompson, and in addition to acting as coordinator of childcare now Nova Scotia, I'm a PhD student at York University, and my research focuses on childcare and other social policy. Um, Last year, I completed a master's degree at Carleton University, and I wrote a research paper called Prefigurative Care, Everyday Activism in Nova Scotia's Childcare Deserts. I was interested in what the lives of folks who do not have access to care look like, particularly in light of the new Canada-wide Early Learning and Childcare Plan that was launched in 2021. And I'm going to tell you a bit about it today. So the focus of my research is childcare deserts. Those are regions where at least 3 children are competing for any one childcare space. And Nova Scotia is a big childcare desert, and it has been for a while. So in a Canadian Centre for Policy Alternatives report on childcare deserts across the country that was published in 2018, 41% of non-school age children in Nova Scotia were shown to be living in a childcare desert. And in the most recent report published this year, this percentage has risen to 47%. So nearly half, which is on par with the rest of the country. So in Halifax Regional Municipality, where most of the children in the province live, about a third of children live in a childcare desert. And in the province's many rural areas, 61% of children don't have access to a childcare space like that. And so this problem is, of course, made worse by high rates of child and family poverty across Nova Scotia. So in my research, I was asking, what do parents' childcare arrangements look like when their kids don't have access to formal childcare? How do they make ends meet? So to help answer these questions, I recruited mothers and caregivers from across Nova Scotia's childcare deserts in regions representing its highest and lowest poverty rates. Over 2 weeks, these folks took some photos in moments inspiring reflection on how they navigate care. They wrote some captions, and then we chatted about their experiences in follow-up interviews. So up against challenges of insufficient childcare access and minimal public support, I found that these folks face really significant challenges, often relying on precarious and costly informal and unlicensed childcare arrangements, but they nevertheless found really creative and innovative solutions to meet their childcare needs. And I wanted to share a few of these with you. So you've likely heard it takes a village to raise a child, and turns out that really is the case in childcare deserts, but it's not always easy. So participants described the really, interdependent social networks that they rely upon and collaborate with to meet childcare needs: friends, families, neighbors, in-laws, as well as, paid childcare workers and babysitters. So in some of these villages, the support they provided was really lovely and really wonderful, whether it was, family offering advice and counsel from afar, or neighbors helping one another out, having, a lot of people that they could draw upon when needed. But for others, it was a little bit more complicated. So participants shared that they could rely on their village for everyday support in the absence of childcare, but it wasn't without a cost. They described really significant investment of time and energy they put into coordinating the support, memorizing the schedules of those able to provide support, and they were kind of doing a kind of mental calculus to meet their childcare needs. So this is an example from Grace, a mother from Dartmouth, and she described this community of care and that she and other parents within her low-income housing complex share. And several of her entries were, the various activities that they all participated in. But her follow-up interview, she described the really complex and oftentimes like transactional dynamics of these support network. These are challenges that, of course, could have been avoided if Grace had access to affordable childcare for her daughter. So many of the entries that participants filled out for me were these typical, family calendars and planners, but they were really messy. They had the names of all the, people and the schedules and all those involved in their children's care, and they offered a snapshot into the really complex planning and coordination that precarious childcare arrangements require. So 2 entries from Kim, who was from Antigonish, were of calendars outlining her childcare schedule for the month, and they offered like a snapshot into the, meticulous planning and coordination. And just the number of people involved in her kids' care. So given her sporadic working schedule as a registered nurse that works night shifts, Kim doesn't have access, or she doesn't require, full-time childcare, nor would she be likely to access it in Antigonish. So she was left to recruit various babysitters to work around her work schedule, either providing care at their homes or in hers, and oftentimes when she was sleeping at home between shifts. So a lot of participants talked about the challenges they face not only with coordinating care for their children before and after work, but also just the incompatibility of work and childcare itself. So participants described how, despite their best efforts, the precarity of their childcare arrangements were seen by their bosses as irresponsibility in the workplace. As Amy shared, something that's really important to me is being reliable at my employment and just showing them I'm serious about it. That's how you get promotions, and that's how, oh, I lost my page. That's how your career can unfold for you in the right way. And this is a name that unreliable childcare regularly interferes with. So many participants also shared struggling to secure childcare when their young children were between the ages of 12 and 18 months. So that gap between the end of parental leaves and the beginning of when a lot of childcare centers accept children. And so they're relying on like precarious and unregulated childcare arrangements that can negatively impact their employment. Sole proprietors who can have an appointment or their care can be interrupted really suddenly, and there's no regulation around that. So it's interesting to note that 3 of 11 participants that I was working with reported adapting their employment to accommodate their childcare needs. So Rebecca from Halifax took a job at a childcare center that could accommodate both herself as a worker and her child as a child at the center. Missy from Digby was an ECE, but she left the sector when she got pregnant amidst the current childcare workforce crisis due to poor working conditions and insufficient compensation to support her family. And when Laura from Annapolis was no longer able to run a daycare center out of her home that was inclusive to her kids with special needs, she went back to school and took out student loans to make ends meet. So Kim, who I mentioned before, this is her cot in the garage. She prefers working night shifts because it's easier to find babysitters to watch her kids during the day when her husband is at work and she's sleeping between shifts. And so she devised this solution so that she can get some sleep when during the day and her kids don't have to tiptoe around the house. She shared, that's something that I'm sure will stay in the garage for years to come because I don't plan to stop working night shifts because it works. So as I was working with mothers and caregivers in childcare deserts, looking at the challenges they face to meet their care needs and these creative, innovative solutions that they found without it, the urgent need for regulated licensed childcare was clear, but so too was the resilience and the ingenuity of these mothers and caregivers. But really, parents should not have to be this resilient. The government can and needs to act. So childcare deserts, they're not inevitable. They result from poor, haphazard planning that leaves childcare expansion to private actors within the market who are ill-equipped to expand childcare equitably into childcare deserts across Nova Scotia. Although childcare fees, as Morna said, has reduced by 50% across the province towards this goal of $10 per day, which isn't accessible for all families, but this is a target that they've met. But it's really only good news for those who are able to access a space for their child, because too many can't. The province has pledged to create 9,500 spaces by April 2026 to reach a coverage rate of 59%. So 59% of children in Nova Scotia are supposed to be able to have access to a childcare space by that time. But that coverage level isn't high enough. And the government's track record on space creation isn't really promising. The province added only 400 spaces in 2022 instead of the 1,500 that they promised. And now that target has been pushed to the end of this year. And due to a lack of transparency on what spaces are being created and where, it's unclear whether they're on track to meet this target either. So we cannot talk about creating more childcare spaces without talking about the ECEs who will provide care to the children who will fill those spaces. We need decent wages and working conditions and strong pensions and benefits to retain the ECEs already working in the sector, as well as to recruit new ECEs to it. Greater retention of ECEs means better access to childcare spots for children and families. Creating spaces and promoting a strong childcare workforce go hand in hand in the creation of a strong system of early learning and childcare. So with this new Canada-wide early learning and childcare plan, Nova Scotia has the opportunity and the responsibility to design a universal, affordable, accessible, inclusive, flexible, and comprehensive childcare system that is responsive to the everyday lives of families and offers high-quality early learning opportunities to children and strong employment opportunities for those ECs on the ground providing childcare in the sector. Families across the province, such as the folks I had the pleasure of working with in my research, who've been struggling for far too long, they deserve it, they need it. And I'm so glad coalitions such as Childcare Now exist and that there are strong advocates like all the folks here today working to push governments to make such a system a reality. So thank you.
Oh, that was excellent, Kenya. Thanks so much for doing the research and sharing the findings with us. I'm exhausted just looking at that calendar. Oh, that was, yeah, really fantastic and underlines why it's so critical that government meaningfully consult and make sure that childcare is accessible in all the ways that it needs to be in responding to the needs of families across the province. Really appreciate that.